a great and full agenda today. Just letting everybody, all our last minute attendees in here from our waiting room, and we'll get started. So just a little bit of background, since we have some new faces on our call. Glad to see you all here. We have been around, our coalition has been around since October of 2020. We are a collaborative group of stakeholders across Fresno, Kings, Madera, and Tulare counties, as most of you know. This group is sponsored by Anthem Blue Cross, Health Net, and CalViva to promote use of eConsult and improvement in access to care across the Central Valley. So we're glad to see our group growing. We have a large group, and you now get a newsletter from us. We're glad to see it growing every month. So you can see here, this is our website, our Central Valley eConsult Coalition website. You can always visit this for our past materials, our past meeting recordings, and just to stay up to speed on what's happening with the coalition. So you can see here, we like to be as inclusive as possible. This group is welcoming and open to all providers, payers, groups, associations, stakeholders across our 4 counties. Please do share this opportunity with your peers. They're welcome to join us. This call is open to all. So I'm going to stop for a minute and point out that since we do have everybody on mute, and thanks again for muting yourselves, if you could take a moment in the chat, if you're new to our group, and just do a quick little introduction in the chat, and I'd like to introduce you personally. So you can see here, I'm not going to list off our large group, but please do take a moment if you can and introduce yourself. And while we're doing that, I'm going to ask for a quick introduction from our planned sponsors. I know, Armando, I know you're new to our group, and maybe you could say a few words on behalf of Anthem. Thank you for joining us. Please introduce yourself, and go ahead and unmute yourself too.
I think I'm unmuted. Good afternoon, everyone. My name is Armando Millan. I recently took on the role of Director of Projects and Product Management for Anthem Blue Cross Medicaid Health Plan. As part of that change, I did inherit a lot of our digital telehealth strategies that we're working on across the state. I'm still getting up to speed on all these projects, but the more I learn, the more I feel that these programs have like really high potential. So I'm very happy to join everyone here and hope to make these projects a success.
Thanks, Armando. Karina, I'm not sure if you'd like to say a few more words just around background on the program and anything you'd like to add. Okay, I'm gonna hand it over to CalViva to say a few words. Jeffrey and Kansa, are you on?
Yes, I'm here, Libby. Good afternoon, everybody. This is Jeffrey Nkanza, Chief Operating Officer for CalViva Health. We've been working with Libby and Anthem and the others here on this Central Valley eConsult Coalition, and we've continued to see the growth. So we've been actually very encouraged. We've seen the potential out there and agree that it will be a good platform to try and work on specialty access here in the Central Valley. So we're encouraged to be here and encouraged to support all of the providers and groups' effort on this initiative.
Thanks so much, Jeffrey. Dee Dee, Dee Dee's just joining now. Mark, do you want to say just a couple words on behalf of HealthNet and California Health and Wellness?
Yeah, thanks, Libby. So my name is Mark Shore. I'm the Director of Telehealth Programs for the California markets across all of our lines of business. We are really excited about the coalition. We've been actively participating in scaling eConsults across our Medi-Cal network statewide, and this really gives us some tailwinds to help certainly in the Central Valley. So thank you. Thanks for all the work you guys are doing, Libby.
Thanks so much. So you're welcome to keep using the chat throughout our call today. If you have questions, comments, if you'd like to share an introduction to yourself. Thank you, UCSF team, for introducing yourself. I know we also have CMSP on our call today. I know Allison Kellen, I saw your name pop up, so thank you to the CMSP team for joining us. And with that, I'm going to move on just to make best use of our time here. And just for those of you who are new, we like to just do a quick little explanation of what eConsult is. If you're new to this program, we're talking about eConsult, which is asynchronous communication between primary care teams and specialists to be able to improve access to care. And so as we approach eConsult, we like to be able to support FQs in whatever we can do, FQs and primary care providers, to be able to look at eConsult as a first step to a referral. So when we think about this, we hope that our primary care provider teams can think of eConsult as a productive use for addressing routine and non-urgent, non-procedural referral requests. And we want this to be open to all provider teams. So I mentioned FQs. This program is also open to independent practices, those primary care providers who serve Medi-Cal patients. And eConsult across our 4 counties is available for all Medi-Cal patients, thanks to our plan sponsors. Just a quick highlight. We want to be able to highlight once a month those active provider teams that we see really putting an effort into this program. So you'll get our newsletter every month. If you're not on our newsletter list, you can email me and I'll make sure to add you to our list. But our most recent spotlight is a thank you to the Omni Health team. So Alex Hernandez, Dr. Hernandez and team have put in a great deal of work over the past few months to stand up their eConsult program. And we see a lot of activity coming out of Omni. So thank you. And last month, we wanted to make sure everyone saw that we highlighted Camarena Health and Basam Calada's team. So thank you. We'll highlight a new team each month. And I wanted to ask our Omni team just to say a few words about their experience to date, maybe share some feedback or any tips, tricks, any observations to date. So I think, Lisa Atkinson, are you going to speak on behalf of Omni?
I am, Libby. Thank you. My name is Lisa Atkinson, and I am the risk manager with Omni Family Health. And I am leading as project manager for this partnership. And the feedback that we've received from the providers, we've received positive feedback regarding the collaboration, specifically for cardiology, and the communication between the specialists recommending additional testing and additional lab ordering. From a project oversight perspective, I do want to say that the speed that the specialists respond is just, it's incredible. Overall, I think that this is a wonderful project, and it's increasing the access for the patients, as what we're seeing is that many specialists are scaling back due to the pandemic and not allowing as many face-to-face visits. So to do this electronically and through eConsult is just, it's amazing. So nothing but good feedback thus far.
Thank you so much for the kind words, Lisa. It's great to hear from Omni, and it's also just helpful to hear just some specific information about your experiences too. So thanks so much. Karina Mendoza, you might want to say a few words. We're excited to have a little thank you for the provider teams that are actively involved. Karina, do you want to say a few words?
Yeah, hi everyone. This is Karina with Anthem Blue Cross. I just wanted to say thank you to Omni and Camarena for all the hard work and leadership they're putting into utilizing eConsults in the Central Valley. So once the COVID-19 restrictions get lifted, or we can coordinate some type of lunch to reward your team for your efforts. So thank you so much.
Libby, I'm not sure if we lost you or if it's me.
You know what? I just muted myself. Thanks so much.
Okay.
I've been talking for about 30 seconds and I was muting others and in the process muted myself. So just wanted to give a quick highlight on what we're seeing so far in 2021. We want to thank those clinics who've been doing this for perhaps a year now, but as our coalitions really gelled in the past few months, we want to track what's happening this year and show that we're happy to see over 11 provider organizations engaged across the 4 counties. 7 are live on eConsult. And we're seeing that over 70% of eConsults are resolved without the need for a face-to-face visit, which is really just so exciting to see. This is improving the experience for our patients, reducing travel time, making this more convenient for our patients to receive specialty advice. And although, specialties that are needed by clinics vary, we know that some clinics may have certain specialties accessible to them. What we're seeing right now in terms of volume is sort of a top 10. But these change every month and change according to who is available at which site, obviously, but we're seeing great activity in these top 10 specialties. And I think the most exciting thing to see is Although specialty availability varies, we see that across the board, across the dozens of specialties that are available to you all, we see that response time is always less than 2 days, so less than 48 hours. In some cases, just a couple of hours, but it's just great to see such quick response time. And please do comment or ask any questions that you have here. And I think with that, I'm going to hand over to our UCSF team. And with that, Petra, are you on? If you wouldn't mind unmuting yourself, and you can introduce your team.
Great. Hi, I'm Petra Steinbushel. I'm a child psychiatrist and director of the UCSF Child and Adolescent Psychiatry Portal, and want to introduce Michelle. Michelle, would you want to introduce yourself?
Hi, I'm Michelle Reeder. I am also a child psychiatrist at UCSF and Associate Director of Community Liaison and Outreach.
Great. And Libby, I'm just wondering if it's possible, thank you for pulling up the slide deck. So just wanted to kind of go through some information about our program and also have a little bit of discussion and time for questions. And so this slide deck is something that we review with practices when we're enrolling them. And so these statistics may be very familiar to everyone on the call here, but basically the prevalence of pediatric mental health conditions is very high. And there's often a very long lag time between the onset of symptoms and time to diagnosis. And we know that 50% of mental illness onsets by age 14 and 75% onsets by age 24. So the time to intervene and really make a difference is when someone is younger. And pediatricians are in a unique position because of their role and their frequent contact with children and their families. They're in a unique position to be at the forefront of assessing and providing initial management and treatment for common mental health conditions. Next slide, please. This map is from the American Academy of Child and Adolescent Psychiatry and just highlights the incredible workforce shortage. So the difficulty that people have in referring to specialty mental health is based on real numbers. There are an estimated 8,000 child psychiatrists in the US, and there's an estimated need for over 40,000. And we know that in the next 10 years, about 25% of the current workforce is set to retire, and we don't have enough replacements kind of in the ranks coming through. Similarly, for developmental pediatricians, there's a significant shortage. There are about 800 developmental pediatricians in the US. And then for child psychologists, there's a significant shortage as well. Next slide, please. So what are some of the challenges? These are longstanding and have to do with kind of a historical separation between the treatment of mind and body. And we really appreciate the kind of ever improving ideas around stigma and separating these things. However, we still have a long way to go. We also know that payers have traditionally carved out mental health conditions, and that it can be really complicated for patients and families to figure out kind of their own puzzle bridge in order to get to see a mental health specialist like Dr. Freud in his office that's about to come up soon in more traditional models of care. And similarly, in traditional models of care, there have often been challenges in having shared record keeping and being able to send notes back and forth and kind of shared communication around patients. And then we also know that that often patients end up staying in the care of a specialist sometimes longer than they need to for what could be straightforward conditions that could be handled in primary care. Next slide, please. So this is a model of integrated care called the STEPPed model. There are other diagrams out that have kind of greater levels of complexity, but this model is put out by the University of Washington Ames Center that really just highlights a modality of treatment that is more heavily utilized in other countries in Europe, in England, in Australia, that has have more socialized systems of care. And it's starting to gain more and more traction in the United States. But basically, that primary care providers in the medical home are at the front line of treatment, and that not everyone needs a referral to specialty mental health. And so we want to support rational utilization of those specialist spots by having consultative integrated care levels, including consultation from specialists. Next slide. So this is geared towards primary care providers who are maybe hearing about these types of models for the first time. We know that pediatricians in particular receive about 1 month of training in developmental pediatrics that's required as part of their residency. And then they may or may not choose to do an elective in child psychiatry. And meanwhile, a significant percentage of CHEAP complaints that are seen both in outpatient and also in inpatient settings often have either a primary or significant comorbid psychiatric diagnosis along with the medical diagnosis. And this kind of mirrors the first state to implement a statewide child psychiatry program, access program like ours, did a lot of preliminary surveys, and initially pediatricians were very uncomfortable with the idea of utilizing a service like this and may much prefer the traditional model of care of just referring everything out. But then once they actually start using it, they really experience a lot of the benefits. Next slide. This is a map that represents child psychiatry access programs across the country. There are now 21 state-funded child psychiatry access programs, and they exist in at least a partial capacity in now 35 states. And HRSA has really gotten behind this and funded the startup of state-funded programs in several states, as you can see here. And they're thought to be kind of 3 core features to these programs that include real-time consultation and also educational activities. And that is really important, not only for imparting the information in the moment and teaching, but also in establishing credibility and expertise of the consultant and building relationships with the program that's delivering the consultation, and also helping to provide networking amongst providers. And then the third component is care coordination. Next slide. So this is our program, and we really do aim to expand mental health care access to many more children. We know that one pediatrician over the course of their careers, if they can better know how to do this and have the skills to do this and feel confident in doing this, that the many thousands of children that they will see over the course of their careers can have a significant impact. Next slide. So this is just further specifics on the services that we offer. And we currently cover about 250,000 pediatric lives, mostly in the greater Bay Area. We have all of our UCSF affiliated internal and also community practices. And then we have enrolled all of the Alameda Healthcare Consortium, which is a Bay Area QHC network. And then we have some practices that we've enrolled as far up as Siskiyou County through some consultation that our teams have been doing through a SAMHSA grant. So, and then we are aiming to expand to the Central Valley. Next slide. So through Proposition 56 funding aimed at behavioral health integration, we have received some funding that goes from now until the end of December 2022 that will expand access to Medi-Cal insured youth up to age 18 in Fresno, Kings, Madera, Tulare, Inyo, and surrounding counties. Next slide. This is our team. We have 7 child psychiatrists and 2 psychologists, one who specializes in early childhood mental health conditions, and one who specializes in conditions ages 6 to 21, and who has experience in consultative modalities. Next slide. So this is kind of the basics of how the direct consultation works. Once a practice is enrolled, and we do like to have enrollment meetings that kind of review this and kind of try to bring the program to life and explain what it is and then what it is not. And also to help build that relationship and understand some of the unique practice needs by practice. Once the program's enrolled, then they can call and they provide brief demographics, and then the psychiatrist calls back within, we try to call back within 5 minutes or less. The only reason that we wouldn't is if there are other calls ahead of that. And the call usually lasts anywhere between 5 and 15 minutes. And then after that, the psychiatrist writes up a summary of what was discussed, including treatment recommendations. And that is either faxed or secure encrypted emailed back to the primary care provider. Next slide. We also offer what's called a second step consultation. So if after that first consultation, there seem to be kind of active issues that the family would benefit from having, from speaking with a psychologist about parent guidance or helping to figure out what might be going on a little bit more diagnostically and figuring out which types of resources would be most appropriate to the situation. This can be done through setting up an appointment as what's called a second step. And this is done during the office hours that we have for psychologists. And just to clarify that this is not ongoing care or a more comprehensive assessment. Next step. We really want to think about this as kind of an exchange and a teachable moment. And this part is really, somewhat different than the e-consults, which we're also very much in support of. And we do offer those within the UCSF system of care and really appreciate the benefits. And then just highlighting that this is, more of a dialogue that helps to promote learning in the moment. Next slide. We also know that physicians tend to be kind of compulsive and want to check off every box. And so rather than having kind of a checklist of things that we are asking about, we like to think about this framework so that it's, we're asking about, are there any current safety concerns? What are the specific behaviors that are happening? In which setting are they happening? Is it school or home or across the board? And then rather than thinking about trauma, thinking about scary things, because trauma can mean a lot of things to a lot of different people. And then what existing screening has happened already and what services might they have in place. And this is more of a framework so that no one feels like, oh, I have to, have all these different pieces of information before I call. And if I don't have them, then I can't call because the person's gonna, be upset with me for not having this information. We just want to make it as easy for people as possible and have as low of a threshold as possible. Next slide. So these are some recent consultation examples and types of questions that we've had come through that might be helpful. Next slide. Thank you. And I do have also just a little bit more information specific to the expansion in the Central Valley. I don't know if it's possible, Libby, to share my screen.
Sure. Hold on. Let me just make sure that you can do that. Okay. So Pedro, go ahead and share your screen.
Great. And I'm seeing Sarah Arnquist on the call. I don't know if you're in a place where you can speak to this a little bit more, but I'm happy to walk it through a little bit and then welcome to have you jump in. So in partnership with Anthem, we received this Prop 56 behavioral health integration funding. And so Beacon will be ensuring program oversight and compliance and coordination amongst the health plans. And then UCSF will be the academic hub that provides, the services that we just walked through. And Anthem on top is the funder, supporting expansion into 3 counties for these.
Thanks, Petra. Sarah or Allison, oh, go ahead.
Oops. Sorry, I was having trouble advancing my slides. And so here's the aim. And so, these are the youth who are enrolled, and we're starting with Fresno County. And then here are the key health system partners. And we have these identified and are in the process of really connecting in a more meaningful way with leads for these. And here's a diagram of how the consultation works. So the patient is at the center, of course, and is receiving care in the medical home. And then the primary care provider calls the psychiatric consultant, and then internally, the behavioral health care coordinator helps assist directly with the patient and or the medical home to figure out appropriate next steps if there is a need for ongoing care and specialty mental health. And here is the logic model.
So Petra, with that, would you like to get some questions from the attendees?
Absolutely.
Great. So feel free to use the chat if you are, if that's the best way to share. Otherwise, we also can allow you to unmute if you have a question for Dr. Steinbushel or the rest of the team. Okay, so I'm going to share my screen and give any folks a moment if they'd like to ask a question. You can feel free to unmute yourself. And Dr. Steinbushel, just some specifics that I know that the primary care teams and the FQs might be interested in are just exactly how to get started. How do they access the program to begin?
Yeah, it's a great question. So really, we welcome you reaching out to us directly. And so I'm just going to type our email address into the chat right here. But please email us if you are interested in enrolling your program. And then the next step from there is that we just collect a few kind of practice demographic, key components that we can, we'll send you a Qualtrics survey that asks for those questions. And then we try to schedule a meeting with as many end users in your practice as possible. And we really have found that having that meeting and being able to kind of walk through this PowerPoint and explain what the program is and then what it is not really helps to clarify things and also to make it come to life a little bit more. And part of that, we ask that each practice ideally try to identify a practice champion to help support the implementation and utilization in the practices. We found that when there is that embedded champion, and that can come from a clinical leader, or it can be, someone who just really is interested in supporting access to mental health care, that really helps a lot in promoting and supporting appropriate use of the program. And then after that meeting, then you're considered enrolled and you can start consulting right away. And then we also ask for email addresses of everyone in the practice so that we can share our newsletter with you and also share updates around trainings and things like that are coming up.
Great. So I will make sure to get the contact information to those attending today, since not everyone can see the chat. So I'll take care of that, Petra, and thank you. Is this immediately available? Can FQs and practices start now?
So we do like to have that enrollment meeting with the practice, and that's important for a few reasons. One is, so that everyone knows how to use it, and also to develop that relationship. And then we need to make sure that we know who's calling and so that we can, collect enough information to help support the funding that we currently have and to promote long-term funding. That said, there is no billing for this that happens. There's no charge to enroll. Everything is free, but we just like to go through that enrollment process and need to do that for the purposes of sustainability.
Thank you, very helpful. Another question came in, can the request for consultation come from an LCSW or does it have to be from a primary care provider?
Great question. So currently we are, the main scope is aimed at primary care providers and assisting them, in the context of the medical home. That said, we certainly have a lot of practices that have integrated care and where PCPs work alongside, LCSWs and other behavioral health providers. And so if that, that relationship and that partnership is happening, then, we can work with the LCSW as the initial consultant. But in terms of scope right now, we don't have it that we're consulting to like independent community organizations with, LCSWs, for example.
That's helpful. And there was a follow-on or associated question here is, are you working with schools? Are schools in scope? So not at this point, but do you envision schools might be part of the effort?
So that is a great question. And that's something that we are planning to expand and grow in our program because we acknowledge, we're anticipating, a really significant increase in need as we start to transition to more in-person school. And we're anticipating a lot of additional requests and kind of more unique presentations. And so we're looking at a consultation to school program as a larger part of what we do. Right now, we're starting to pilot that.
Wonderful. Thank you so much. Another question came in. There's a mention of consultations for PCPs or parents. So can parents get the consults directly from a referral from the PCP? I think that's sort of the second step, but could you just clarify that one more time for us?
Yes, sure. So the initial consult needs to come from the primary care practice. And then with that, if there is a determination that, the parents would really benefit from some parent guidance, either about, symptoms and behaviors and or about navigating the system of care, then that's something that can be arranged as a second step. But we are not a direct service provision program. So we are a consultative program and want to keep that relationship clear, that it's consultative.
Thanks, Petra. And another question, I believe this is available to all of the FQs across the 4 counties. Is that correct?
Yes.
Wonderful. So thank you to those who are on the call today. We'll make sure that your information is available to the UCSF team since we now have, I think, 12 FQs involved. So it's exciting to see our group grow. Any other questions? If you need to unmute yourself to ask a question, you're welcome to do that if you're not on Zoom. Okay, so with that, I think what we'll do is if you have additional questions for the UCSF team, we will capture them. You can send them to me by email and we can correspond and make sure that everybody has the contact information for the program. I'll give a minute for Karina Mendoza to say a few words about the connection of the programs. Karina, do you want to go ahead?
Yeah, I just wanted to say that, this UCSF program is really exciting to introduce through the Central Valley Coalition, especially because the focus is on children and adolescents for a much needed specialty service that we all have recognized has access barriers in regards to behavioral health services in the Central Valley. So I just wanted to mention, as Petra said earlier, that this program is recognized and funded by DHCS, as well as funding from Anthem to continue to provide a different modality of provider to provider communication. So kind of building on the e-consults and moving forward with the provider to provider communication through this warm line. So really excited to see what comes out of this program. And again, if there's any interest from the FQHCs, make sure to reach out and let us know. Thank you.
Thanks, Karina. And I believe you were going to, you wanted to make another announcement before we move on?
Yes, yes. So I did want to let everybody on the call know that Anthem does have a quality incentive program by the name of Clinic Pay for Performance, or CP4P. And this program is mainly focused on working with FQHCs to build or improve their HEDIS metrics and scores, but there's also a separate, or in addition to this CP4P program, which is an incentivizing program, different quality improvement activities that an FQHC implements. So one of those activities that we have decided to include for this year is an e-consult incentive. So I believe 9 FQHCs that are participating in the Central Valley e-consult Coalition are already enrolled in our CP4P program. So this is just another way that we would be working with your FQHCs to recognize all the work that you're doing regarding e-consults and providing a way to incentivize on that for the FQHCs. So your quality lead, you guys, all the FQHCs do have a quality lead that, you know, works with the quality departments at the FQHCs to go over the program manuals for CP4P. So if they haven't reached out, they will be soon. And I'll probably also be included on that call just to answer any questions regarding this new e-consult incentive. So I just wanted to share that news as well. So thank you.
Thanks, Karina. We do want to make sure that we save some time during each of our calls if there are related programs, announcements, opportunities for our participants to share events, share announcements. We'd love to be able to capture those, and so please do reach out if you'd like to share anything on an upcoming call. Quick announcement or thanks to those who attended our March 30th continuing medical education session. So those who had an opportunity to join, this was an education session led by Delphine Tuo of UCSF SF General, along with Darren Anderson out of CHC Connecticut, clinical advisors to our program who shared best practices around eConsult. This was available for CME continuing education for providers. And we'd like to offer ongoing or continued sessions in the future. So please do reach out if you'd like to gather your group, your providers at your FQ or at your health system to attend a future session, and we can arrange it around your provider's schedules, like a staff meeting or a regularly scheduled meeting that works into their schedules. Some quick highlights. We were pleased to see that this was so well received. Those who did attend and rated our session noted that it was very educational, that there were great pearls, clinical pearls, that is. And I like this, ways to reframe the importance of eConsult to the patient. And just quick ratings of the session were, as you can see, the blue bars here, so above average reception for the presentation, the content, the cases presented, and the facilitation of the session. So just we appreciate our clinical advisors for doing this for us, and we hope that we can do it again. Another announcement we wanted to share with you all. We were so pleased to have Dr. Joel Ramirez from Camarena speak on behalf of the Central Valley and our work to Senate Health back in March, presenting State Bill 365, which we discussed on our last call. Senator Ana Caballero introduced this bill that passed unanimously in Senate Health Committee. So we're just so happy. So many of you were able to support this for us and add your signatures to our letter in support of the bill. The next steps for this are that it will be heard in appropriations on May 3rd. So we just appreciate your support, and we're excited to see that this will be moving forward. If you were not on our last call, this is a bill that is supporting FQHC primary care provider reimbursement for eConsults. If you've been tracking this, which I know it gets in a little bit in the weeds, currently specialists are reimbursed or are capable of being reimbursed in Medi-Cal. in California. Right now, primary care providers are not reimbursed for e-consults, so just very basics there, but we are working toward both primary care and FQ reimbursement, and we will track this and provide an announcement on our next work group call to see how this is progressing. Please do share any questions on that. We're happy to provide any clarification if it's needed. And I noted here that if you are interested in following what's happening with e-consult and telehealth policy, in addition to what we discuss on our calls, you are welcome to join in the California Telehealth Policy Coalition. We work closely with them. We like to share that we have a monthly, obviously we have our monthly roundtable that you're on today that is focused on our Central Valley work. But in addition, we work with the e-consult work group, which is a California Healthcare Foundation funded project that meets on a monthly basis for further discussion on e-consult reimbursement and policy and adoption best practices across the country and actually Canada too. So our next work group is next week on the 27th, speaking specifically to the cost effectiveness that systems have seen by utilizing e-consult. So we have a couple of examples. One, a very interesting publication by the VA that has come out recently. So we have a VA speaker who will share their study, their in-depth study on cost savings. And in addition, we have Monarch Healthcare down in Orange County sharing their examples of cost effectiveness. So most of you have received an invitation to this. If you haven't, I can make sure that you get that invitation, and the link to join April 27th is right here in the slide. So we really thank you for your time and just for joining us on a monthly basis. We know that this is a very busy time for us all. We are happy to see the light at the end of the tunnel in terms of COVID with so many vaccinations taking place. We know that's really taking a bulk of the time for our providers. So we appreciate you taking some time out to joining us here. In the next year, what we like to focus or like to share in terms of our focus areas for the coalition are really reaching out to our local partners, your collaborators across the counties, your referral partners. We want to be able to engage specialists in our effort. So if you do have specialty referral partners that you'd like us to invite to the coalition, please do share those contacts and we'll make sure that they get an invite. We are working, as you know, on e-consult reimbursement across California and working to make sure that all patients across your practices are covered. So all patients can receive e-consults. And we'll continue sharing the data that we see is coming out of the program and want to be able to make this an informative call. So if you have any questions, recommendations of content we can cover on a monthly basis, we welcome those. With that, I'm going to offer an opportunity for any questions. I'll check the chat. In the meantime, I'll hand it over to our sponsors just for a moment in terms of wrap up. Karina, do you have any words to share as we close?
No, nothing else to add from me. Just many thanks to all the FQHCs and everyone who's engaged in the coalition. So thank you.
Thanks, Karina. Jeffrey, did you have anything to add?
The same, Libby, just echoing thanks for everyone who's participating in the program. And then also just special thanks also to the Omni Family Health Clinic Spotlight. I think it was good to hear about the specific experiences that they've had to date with e-consults. So thanks again for sharing.
Thanks, Jeffrey. Yes, and thank you, Lisa. Thank you for sharing with us today. Dee Dee and Mark, do you have any closing words from HealthNet?
Just echoing again, what a great effort this is, and thanks to everybody that's participated, sponsored, and just came to the table and spent time. This is an important effort, and we very much appreciate it. Thank you.
Thanks, Mark. So please do take a moment to look at the chat here. There are a few links to websites that will be important as we move forward. So I mentioned the California Telehealth Policy Coalition. If you'd like to join future calls, you can see the link there from Timmy. Our e-consult work group page for our next week's call, for our April 27th call. Information can be found there, and that you'll get that. You actually received it in your newsletter, your Central Valley E-Consult Coalition newsletter, if you'd like to attend the cost effectiveness presentation next week. And just a quick little note, the e-consult work group website has a playbook of best practices. So if you are interested in hearing how other practices are using eConsult and helping with their implementation, you can check out our playbook. And our econsultworkgroup.com/Fresno. We started out just Fresno and we are so excited we've grown. So our Central Valley eConsult Coalition page is there too. And Pedro, thank you again for sharing the CAP program information in the chat. We'll make sure everybody receives these links. And you have my email address. You all get my emails. I hope not too many emails, but you can always share any questions with me. And we thank you for your time today. Have a great day.